Hello and welcome to our hospital. We have recently seen an increase in the number of American Muslim patients coming in for treatment that require specific healthcare accommodations. To effectively interact with these patients, we are offering more training, such as this one. As healthcare professionals, understanding our patients' culture is an important aspect of our job, and we want to offer them the best quality care that we can provide.
Hello, my name is Margaret Allen, and I'm here to discuss policies for American Muslims. As healthcare professionals, we all need to be aware of issues pertaining to privacy and touch, dietary needs, and medicine that is unacceptable. Care of an American Muslim should be given by a person of the same gender. If a member of the healthcare team of the same gender is not available, the professional of the opposite gender must not make eye contact or physical contact. Male doctors of female patients are required to communicate to the patient's spouse. The provider can ask the female patient if it is okay to speak with her partner. If the patient is alone and the provider is of the opposite gender, there should be another healthcare provider of the same gender of the patient in the room. Male patients with beards that need to be shaved should be shaved by another male. Special care needs to be taken into consideration during Ramadan, Islam's holy month. Professionals will need to be particularly mindful, sensitive, and respectful of cultural needs during this time. Muslims' culture and religion influence the perspective they have on healthcare and the providers of healthcare. With that said, please review the provided documentation that will give you knowledge as well as understanding of Muslim patients so you can provide healthcare that is culturally sensitive. Thank you.
There are situations where Muslims are discriminated against in a hospital setting. In Virginia, for example, there was a family that went to go visit another family member who had just had a baby. Of course, they were Muslims, and upon arriving, the security guard stopped them and told them that they looked scary and that they didn't belong there. When they asked to speak to a supervisor, the supervisor told them that no one wanted them there either. Another example was in New Jersey, where a Muslim woman went to the emergency room complaining of chest pain. Due to her religious beliefs, she asked for a female to perform the electrocardiogram. Of course, then the hospital did not grant that request, and she lingered for 5 hours until her husband finally demanded a transfer to another hospital. So these situations do happen, and they are serious. There are many best practices that can be followed in order to be more culturally sensitive. One of those is to make sure that there's always a translator present when going over medical history or explaining treatment that is needed. When that's not possible, there are applications such as Google Translate that can be used in order to assist the patient in understanding what they're saying as well. Also, creating a disease management program for cultures that are prevalent in the area in order to have more successful outcomes is another best practice that should be followed and used. Another thing is we can hire diverse staff in order to deal with the different cultures that are in the area so that it's more quick response time in dealing with those patients and being able to understand them better.
In regards to American Muslims needing specific healthcare accommodations, I've identified several ways that hospitals can use internal resources to better accommodate American Muslims. One way is by using self-assessments to grade the organization in the areas of cultural competency. A second is employee development and continuing education programs put into place by the HR department. The third internal resource is a resource that is already heavily used in hospitals, which is the
Also
chaplain.
identifying different organizations that can help assist the hospital with the American Muslim population. There are a few tools and organizations that we can definitely use. One of those tools, which is a great research, kind of gives you a background history of everything, is www.tolerance.org, which is the Teaching Tolerance website. It talks about American Muslim history. It can talk about all different sorts of populations that we might have any questions for, and it is a great research tool for us as a facility to use. An organization that would specifically help us with American Muslims is the Islamic Medical Associations of North America. Their website is www.imana.org.
As this training on American Muslim culture interaction in healthcare setting comes to an end, we hope that you have learned some valuable information that will help you assist these patients. Whether it is learning about the patient's medical accommodations, using translator services, or sharing additional resources that could help them in their healthcare journey with us, we will provide them top quality care that they expect to receive as a culturally competent healthcare provider.